You mentioned something about the waiting period. Now, I understand the waiting period, like
Hmm.
why an employer would want that put in
Sure.
to
Yeah.
save costs.
Cost containment.
Everybody,
Absolutely.
oh
Yeah.
my gosh, everybody hops jobs now. So, like, you get
Yeah.
somebody in and they get 2 crowns and you're cooked, they leave, and then now your premium goes up. So, I
Yeah.
understand that, but it is a consumer protection for the employer. So, I can see both
Sure.
employees. So, I can see
Sure.
both
Yeah.
points of view. But it sounds like when laws like that get passed, is it because the Department of Insurance or Department of Healthcare Management gets a ton of complaints? Like, help me understand what spurs these laws. Like, what triggers it to the point that it gets now to your attention?
Well, it's definitely the consumers or the consumer complaints, but also think about if you're paying into a policy, I'm paying a portion of my premium of a policy that I'm not able to use. I'm not able to use some of those policy dollars for it. You kind of understand it a little bit where you want to build up a little bit of a bank of some of those premium dollars. But when I was in office, I used to get really creative with some of those where they wouldn't have a waiting period on major services, but they would for your restorative. So if the patient needed to have a root canal prior to the crown, well, the root canal didn't have a waiting period. So then we could get them in for the root canal and then wait
Yeah.
and do the crown, a little bit later. But yeah, it's really taxing for the offices to have to coordinate some of those things. And it's, at times it's definitely unfair for those patients that are needing to use those dollars and they think that they've signed up for a policy that they can start using immediately. And, they can't down the road. So
Would you like to hear more? Follow the link for the full episode.